Hello, welcome everybody. We're just waiting for a few people to come in before we start the first in the webinar, in Maldaba's webinar series on creating sustainable development. We'll wait a couple of minutes just to let people in, so we're all ready to go. Just get your coffee ready, relax, but also be on your mettle to ask us the hard questions as well. That's what we sort of think we want. I can see Valerie and Steve and Hugh and Simon and John. Welcome. We're just waiting for a few more to come in. Yeah, so it's 1 minute past, so we'll just keep going. But I'm looking forward to the start of this session. Creating sustainable development in social care is what we're all about today. And we've got some great panelists, so we're just going to wait a minute or so. So I think, yeah, we'll just leave it a couple more minutes just before people come in. So, good morning, everybody. Thank you very much for joining us. It's just about 2 minutes past 11, so we said an 11 o'clock start. So it'd be good to start now to give us the most of the hour, and people will join as we go along. So thank you for joining us today. This is the first in a series of webinars hosted by Maldaba on creating sustainable development in social care. I think that's what we're all about today. And the first issue we want to look at today is digital maturity in health and social care. Now, in the prep leading up to this, we've had many angles on what actual digital maturity means, and it means different things to different people in a way. And we're going to explore that. And the ideas that we're bringing in are about cultural change in social care, about the systemic change that we need to see, and that's partly within social care, but that's also in part of an integrated health care and maybe even housing system that we need to look at. And then we're also going to delve into some of the ideas of the implementation of new tech and digital tools and ways of working in care. And we're looking at sustainability, because we also want to think about what we're doing, what we're looking at in introducing new technology, introducing digital ways of working in care, is about how we change the way of caring, how we can actually look after people's well-being and quality of life with more dexterity, greater options for people to empower themselves. And that's what we're going to sort of explore today. So the panel today has an experience of care from many angles, and every panelist is engaged in tech in such a way to develop that, figure out how we care, that issue of how we care. So we're going to engage them in conversation, bringing out their thoughts on digital maturity in the sector. And we're keen to hear your views. So please put any views, but then it can be comments or questions, in the Q&A as we go along, and we'll try and address your concerns on a dynamic basis as we go through. So first of all, I'm going to ask each of the panelists, to Lorenzo, Emma, and Ben, I'm going to ask them the question how we're maturing and what are the high points and the stumbling blocks. And I'd like each of them to give us one example of how we think the social care, I say sector, but I actually prefer using the word social care community, because we're all part of the social care community, how the social care community has matured. And one example also of bringing where the barriers to this development. So turning first to you, Lorenzo, as the progenitor is the word I've used, as the genesis of so much good that's happening within the care community. Where do you think we are on this question? To you, Lorenzo.
Well, thanks, Daniel. Not sure I'm entirely justified with that sort of introduction, but I'll take it nonetheless. Thank you. Yeah, so I think in terms of where we are on maturity of technology in social care, things are moving forward. There is positivity. There are lots of great stories, and there are lots of really exciting people trying to solve challenges and problems there. And we've seen that ourselves in work with organisations such as HFT, care provider for people with learning disabilities, how we've supported some frontline staff, for example, in working with their clients, people with learning disabilities, in ways that even the staff didn't think would take place due to the introduction of our technology of Hear Me Now, whereby it allowed people to articulate themselves in ways that were unanticipated. For example, one woman who had verbal capabilities but was very shy and wouldn't talk in a group, because she had the backup of Hear Me Now, was suddenly really expressing herself and was able to say much more about what she wanted, what she liked, what she enjoyed, and share her activities. She was into knitting, for example, about going to her knitting group and bringing that back, and it really surprised the care workers, and that was incredibly rewarding because the care workers knew that individual really, really well, but they didn't anticipate that by something as simple as providing that support through technology to give her something that she could rely on that was hers, that didn't belong to anyone else, also gave her that confidence and was a massive turnaround in her personality. And they became strong supporters of the project. I think where there's still negativity and where there's work to be done is that a lot of the infrastructures, the systemic setups of organizations and mindsets are not where they need to be in order to embrace some of this and in order to enable it to flourish as well as it can do. So you get these pockets of great stories, and everyone that you talk to in this sector will have a similar great story, but it's then how you expand upon that into something that is just becomes part of everyone's working life, and those structures still need to be developed further.
So what you pointed to there, Lorenzo, is what came over me was this flexibility, and it's really interesting because what you say, the unexpected gains of people being open to those. It's funny, it's strange. It mirrors what we're seeing with the use of generative AI at the moment, of things developing in ways which people aren't expecting, and the technology almost having a character to bring people out in a way.
Well,
that's a spark.
Yeah, I think with a lot of the best innovations, they acknowledge it's not just user-centered design, which pretty much everyone does these days, as they should, but it's also acknowledging that the circumstances and the context of each person is different, and the technology, the software, the service offer, the product, whatever it is, has to be able to flex to what is specific for that person's needs and requirements. And when you can do that, then I think you create something that is incredibly valuable, because it's valuable to that person rather than just feeling like they're kind of on a conveyor belt of services, that they're one of many, kind of a number almost sort of thing.
It's really interesting that we will come on to more the personalization that's actually possible. What we're now is we're empowering people. And if I define social care as the helping people to live as independently as possible, appropriate to their situation, that's something you're starting to deal with there, Lorenzo.
Yeah, absolutely. Personalization of care is undeniably where it has to get to, and we have to shift away from this mindset of large organizations holding information on behalf of other people and giving it to them when you determine that that's right, and saying, well, actually you need to be an active participant and an active contributor to your own health and well-being. It's the only way that, with the changes in our demographics, that we're going to be able to sustain a better community-based health and care support network. So there has to be that huge mindset shift, and with that shift needs to come this understanding that if I'm at the center of it, I need to be able to determine what I need, when and why, and have those conversations. And whilst that is a challenge of sorts for people who are quite kind of capable and able to do so, it's an even bigger issue for vulnerable cohorts, where whether they have verbal skills or not, will struggle to articulate and to argue their point, and they shouldn't need to. They should be able to have the tools to enable them to have that personalization and to make those decisions for themselves where appropriate.
Brilliant. I think that's a really good point to bring in Emma. You actually quoted the organisation Emma used to work for, HFT. So Emma, to pick up on that point about Lorenzo saying about this flexibility, about the personalisation, it'd be interesting to get your view, for you to introduce yourself first, and then give your view on digital maturity, where we are, and some examples that you're seeing in real life.
Yeah, absolutely. So yeah, I'm Emma. So a majority of my career has been spent working with HFT, who support adults with learning disabilities, and that was leading HFT's personalised technology team and also establishing their consultancy service. So most of my experience is in sort of implementation of technology and actually working with the frontline staff and users, and looking at ways that we can actually take that personalized approach, which is so important. And I think that we really need to make sure that we don't forget about that ethical approach when we are using technology with people. In terms of sort of the digital maturity, I think as Lorenzo touched on, there's definitely some great examples of best practice and pockets where technology is being adopted and working really well. But for me, when I was first asked to join this webinar, actually, the two things that really sprang to mind initially was the people and culture. So actually, when I say the people, I mean focusing on the end users, the frontline users, the end users, which can be frontline staff, the supported person, management, whoever that is, focusing on them and how we can support them to understand the technology and respect the technology and really embrace it so that they become champions of technology. And the other area really is around that, and that really links into culture and how we need to change the culture to be much more innovative and creative and encourage positive risk taking, so that people will feel that they can embrace technology and also try new things. And I think at the moment that is the challenge. So I think, yeah, digital maturity, we are making wave, and I think the digitization of care records is kind of supporting that to a certain extent in with providers. But we need to change the culture, and that's all stakeholders, not just providers, but also the end user, families and commissioners as well, and how we can look at different and more innovative ways of commissioning, so that we can start to look at outcomes. And I think one of the things for providers that's a really big challenge at the moment is that there's no real incentive to adopt technology in a robust and sort of strategic way, because the commissioning models don't allow for that. Most packages are delivered by they're very time measured hours rather than outcomes. So for me, those are the barriers really. But that's not to say that there's some great examples happening.
It's very clear when we've been prepping and talking, you and I, Emma, and with a group of us, that, as you set out as an independent consultant, those are some of the issues that you want to deal with, that cultural and systemic change and the end user. So is digital maturity there for you? Is it about a wider systemic cultural change? And can you give some examples in HFT how you've maybe worked with commissioners to bring them, local authority commissioners, to bring them into this digital maturity model paradigm that we want to reach, and what is digital maturity for them, do you think?
Yeah. So I think that there has been some examples where we've worked with commissioners. I think where we've had some good results is where there's been a move on projects where people have moved out into the community from sort of more campus style, the old sort of traditional style settings,
enabled by digital
and actually building that technology into that right from the word go. And that's where we've seen the greatest success when working with commissioners. So the technology is part of that move, it's part of the care package, and it's also used as a tool in the new environment right from word go, so it's not put in retrospectively. So it's expected that will be part of some, and is part of somebody's support plan, but also looking at how technology can be used so that people are supported in different ways. So it might be a phased approach where technology is there to manage those sort of more mundane tasks, those prompting tasks, but actually, and then staff can offer more meaningful support, supporting them to get out into the community, find employment, making those sort of social connections which people struggle with.
That's brilliant. I mean, we'll come on to, I think, how people are pushing us as professionals in the area to actually improve and up our game, and that's a really good place where we should be. I think that's a good point to come in to Ben from Care City. Care City is an organisation I've thought very highly for a long time. So great, Ben. It's over to you really to bring something to bring it all together for us. How this digital maturity paradigm is taking place in social care, in the social care community. Over to you, Ben.
It's quite nice working for Care City. They were set up by the local authority and NHS working together about 10 years ago, trying to get social care in the NHS to start working more collaboratively before the age of the ICBs. And so we engage with quite a number of different providers of different technologies that will come to us, and we look about doing some real world evaluations of things. And I think what we're seeing is that actually commissioners get it. They understand that they want to do outcomes-based approaches. There's, it's often they feel like their hands are tied with regards to established contracts, but also there's a certain lack of trust on both sides about how things are working. And I think that one of the great things about a lot of these digital tools is that they can provide analytics and matrix to show how we can demonstrate how good quality the things and the products that are being developed can work, and that can help build that level of trust so that we can then justify shifting over to an outcomes-based tool from a commissioner's perspective. I think we can always justify it from our perspective. We really want to see that. I think the difficulty we're seeing, though, is that it's a bit like the Wild West at the moment. We're seeing that there's very little legal frameworks. There's very little sort of unfair competition and practices, sort of regulations in place. So we're seeing some large organisations really get the monopoly on, for example, electronic healthcare records. And so we have situations where we will be working with an organization. They'll come up with a really innovative product, and then we'll have to get it to working with some of these larger organizations, and often the only people you can speak to are the salespeople. And I think that the difficulty we're having with that is that often the first conversation will be, okay, we need to have 50% of your business and an upfront payment of tens of thousands of pounds before we'll let you have access to the patient records. And you end up feeling that you've just been mugged before you've had any more of a conversation. And that's a real danger, and it really puts off a lot of innovators that are developing products. So it can be quite difficult.
It's really interesting there, because when you say that issue of the digital social care records in social care, it's really interesting because in health, for example, there are three among the hospitals. There's like three main providers of electronic health records. In social care, we have, I can name you 20 to 30, almost 40, 20 on the assured supplier list. And the focus on them has been great. But what you're saying is that maturity is something about the balance between new technology and people having a stable base as well. So how do you have that creative tension in a way in the sector? And bearing in mind that people as the end users are the ones who are feeling the end pressure that makes.
Yeah, I kind of feel like digital maturity is we would often tell people that are developing products that you, as Emma said, you want to spend just as much time working on creating and changing culture as you want to develop your product. Because you can have a great product, but unless you have champions within the service who will champion what you're doing, and you get people that really see the benefits of it. And there are a lot of pressures on commissioners. You know, we said that sort of the budgets are set out before they even get a chance to do their job. So the more ways you can articulate how your product or how the thing that you're creating helps to identify some of those things. So some of the larger providers may say, well, this is our subscription model. Here we go. Can we have our hundreds of thousands of pounds in the care sector? The commissioners will then say, well, you know, I'm also looking for something that can help us with cybersecurity, for example, or some of the other areas that they are interested in. So the more you can say well, your product achieves multiple goals, the more likely you are to get it adopted or pique the interest of the person who's commissioning.
We said we'd listen to people in the chat, and there's some starting to be some interesting chat through the system. Hugh, I mean, Ben, sorry, to build on your point, Ben, this does build. Hugh was saying, you know, there's the strategic issues we've got here. Is it an implementation and transformation deficit because the front line traditionally have been de-skilled by middle and senior managers? And Lorenzo, to come to you on this, to carry on from Ben, is there a real issue in here of how we view care workers, people who are at the front line, as Emma referred to them?
Yes, undoubtedly, if we think about them at all, which is part of the problem, is that they are very often kind of treated so badly. It's no surprise that they will kind of at some point, despite all their best endeavours, decide that it's just easier for them to go and get a job at a supermarket where they'll be paid better. And I completely understand that. I think we need to focus on those frontline workers, but not lay the blame there. You know, it's the responsibility of the organisations, of the senior management team, of the middle managers, of the way the whole organisation is structured to better support those people in a range of different ways, including the adoption of technology. And it kind of touches back on some of the points Ben was making earlier, that you have to create a culture whereby most of the things that we're doing is actually culture change. Yes, the technology is really just the tool. One of the things we say, and it's why our strapline at Maldaba is software development for humans, is you can create whatever sort of technology you want, but technology is just a tool, and a tool can be used well or badly. It can make a good thing better and it can make a bad thing worse. Technology is never the answer, it's just the enabler to it, and that will only improve the situation if the culture is open to it, can absorb it, can adapt to it, and then bring about the cultural change that you know is needed. And that's not a trivial thing. It's easy for someone like me to sit on the sidelines and say, oh well, you know, it's all culture change. We've worked on a lot of projects where we understand that doing that is really hard. It's really difficult. It challenges a lot of people's perceptions about their identity, about who they are, because we define ourselves through our jobs and through our work. But it's a necessary part of the process that we have to go through in saying we need to work in a different way, because the old ways of working just don't fit the new context, the new technology, the new demands on people's time.
In doing that, Lorenzo, do we need to change almost society's expectations? I know that's a bit too wide, but you're changing how the social structure, social fabric almost in what you're doing. And I know, having done some work with Maldaba, and I'll bring Emma in a minute because you've done a lot of work with Maldaba, about how you, as an innovator, someone who wants to create new ways of working, how does that play in with you, taking people into account?
I actually think that the sort of broader social side is probably ahead of the organisations. You know, I've lost count of the number of times when we start engaging with community organisations, care organisations, local health organisations, and staff there will say, well, this won't work because our patients have these sort of needs and these sort of expectations, and those barriers and those objections, which are quite understandable, will come from staff. When we actually start engaging with the broader population, people who are the patients, people with lived experience, families and carers, they're almost always much more enthusiastic and they're much more open to it. So I think that kind of level of culture change is happening anyway all the time, because there are very few people now who don't have a mobile phone that is quite sophisticated using Android or Apple, don't have a tablet, and is probably ahead of the game of where those organizations, which are much slower to change because it's hard to do and it does carry risk, and actually would be really good people to support and lead that change within those organizations.
So I'm interested in that leadership, because in that social change. And Ben, how are you seeing that play in? Because one of the examples I took early on was, I remember Tesco. I mean, I love bringing examples in from other areas, and Tesco had younger people being mentors to some of the senior management, and it was challenging the ways they were working. We've talked about these who mentioned it in here about the hierarchies and de-skilling. It's that social or mobility or flexibility that we need to build in as a part of. Is that part of digital maturity of an organization, Ben?
Yeah, I think so, and I think what we're also seeing is that a number of people are becoming aware of what's possible. So, as Lorenzo was saying, you know, when you speak to people and we talk about a new product, ultimately people will say, "But I want to see the data myself." You know, various different groups. We'll go to different places, and people will say, "Okay, this is great. You got this tool that will tell my care worker something. Could you get it also to tell me something as well, so that I can start learning to do my own changes and make changes in my own life and take personal responsibility?" And people are curious and interested in this. And I think there are a lot of barriers that organizations will put up, such as IG and safeguarding. And I've been working in the safeguarding area for a number of years, and rightly so. But then there's also, these things are designed to try and make things happen, and often they're put up as barriers to stop things from happening. And so a lot of it comes down to trying to we talk about digital maturity, is saying what we've thought about this. We're able to articulate how we've thought about this and demonstrate how we do this. You know, we get quite often companies that provide sensor equipment for older people's homes and say, you know, we can be able to provide you all this analytics.
When you say sensor equipment, Ben, can you just say what that?
So it might be that a person sensors to make sure to track where a person will get out of bed at night, or will try to leave their flat, well, there's a certain degree of that level of monitoring has to have consent, and there's a sort of legal process to go through this, and a number of those organizations just haven't considered the sort of legal side of things. And so there's a kind of legal literacy that you need to be mature with to be able to say, well, actually, we've thought about these processes, we've gone through this, and we have an answer to this, rather than just saying we have a piece of kit, which is what Lorenzo's been saying. You know, it's not just about having a technology answer, it's about having an answer that suits the legal framework, which many people maybe are not aware of, but also the culture of the organization you're trying to introduce that in, and also put it the end person who's going to be benefiting hopefully from this technology, so they can say, well, actually, I want to access this information myself. This has to be they want it to be a collaborative experience.
So, and that's really interesting, because the people hiding behind IG, the way I've always seen it, and all these issues, these accessibility type issues and data, is actually it's a way in. If you open the box, don't be scared of it, because it opens new avenues. So positive. Have you seen positive ways? And either any of you, Lorenzo, Ben, or Emma, have you seen where data is being used for the positive good of people? So people grasp these issues about data, safeguarding, people's information is their information. People have grasped those issues, and actually it's made a difference to how they can live.
Well, we have a... Oh, sorry, Emma, go ahead.
No.
Ben first, and then Emma.
I was just going to say, yeah, we've used various different sort of sensor-based monitoring or assessment tools that can gather data to look at people's activity or inactivity, and the results of that have, I think there's a danger actually that those types of technologies are seen as a way of cutting hours or cutting support, traditionally used to cut night support. But actually I've seen those systems used in a really positive way, where it's actually identified that somebody has a health need that might need looking at by a doctor, for example, and they've been diagnosed with early onset of dementia, where they've been getting up in the middle of the night, and nobody's known that necessarily.
So before, what would have happened before?
Well, nobody would have known, so they would have just looked at that person and said, well, that their behaviour's changing, they're becoming very challenging, but we wouldn't actually know why. So having that evidence of what's happening when there's not a member of staff there all the time can really help to get the person the right support that they need, both in terms of their health needs, but also in terms of their social needs. And as well, we've used those sorts of technologies to change support hours as well. So actually highlighting that somebody might need more support at night, not less support, because they've actually been getting up at night and going out the front door unsupported, which poses a risk. So yeah, I think that yeah, that for me is sort of a really good example where they've been used in really positive ways.
Really good example, Emma. And Ben, to bring you in, sorry, Lorenzo, Ben, to bring you in at the moment, because you were just coming in there. But that what Emma's all hinting at, some of that is what you started talking about, but it's also the incentivization there is there for the system. What Emma was saying, that it creates a better integrated system. This use of this data, the digital maturity of organizations grasping that nettle and saying, actually, we can do positive things for people with this new technology and our role of digital maturity.
Yeah, the idea is that if we can use some of this technology to be able to assistive technology to be able to help people to be able to be independent, then you can focus the limited resources you have on people's actual needs. And sometimes, you know, we hear quite often examples of people that have drilled down and done analysis and said, no, actually now we've found out that what this person really needs.
Any concrete examples of that? Of like,
yeah, well, we went through the whole case of a person kept having falls, and it wasn't until someone came to a visit and do a site visit they realized that actually there wasn't a light bulb, or the light bulb had broken on the stairs. So the person kept having falls on the stairs, and all you needed to do was replace the light bulb. That's
I love it when low tech actually stems from high tech. That's great.
But what comes up is that actually the number of different falls that person had got triggered an alert to say, look, this should be reviewed. And so that's where the technology comes into making sure that happens. We're doing a project at the moment where we're looking at sort of AI predicting which people are likely to have falls based upon their previous admissions and different ways they've been engaging with different things. And it's quite, I mean, it's not hugely accurate, but it's really good at providing indicative saying that these people are at risk of falls. So then what do you do with that data? How do you help and support the people? And that's what we're doing a project at the moment, to sort of engage with people and say, you know, it's actually, you know, how much information do you want, and how do we actually provide this to people in a way that's safe?
And building on that, some of the chat is actually building on that, Ben. And you know, Steve here is saying that, you know, local authorities have a choice of how they use their money, and using technology, as you're saying, can actually help them in that way. And as Steve is saying, as Emma's pointed out, there needs to be a dramatic move to outcome-led commissioning. To bring you in here, Lorenzo, are you seeing that mindset change and that individualization that Ben's talking about? How are you viewing that? Another point you want to make?
Yeah, I was thinking about your question, your challenge to us about positive examples of IG and usage of that, and it actually does tie into the point you're asking now about individualization. We for a lot of years we worked very closely with and supported an end-of-life charity called My Living Will that eventually became part of Age UK, that was all about raising awareness of, informing people about the options that they had towards the end of their life regarding things like advanced decisions and advanced statements. And we provided quite a lot of technology for them to then work with the public to create their own very individualized personal advanced decision and advanced statements. And the reason it was a problem to solve in the first place was because, well, firstly, most people didn't know about the legislation that had gone through in the 2010s around this and giving people the options to choose, and they didn't really know what their options were, and it meant, and they weren't having those conversations with their families, with their GPs, with their care teams as it came towards the end of life. And that then means that because people do their very best job and de-risk a situation, they were resuscitating people and continuing to keep people alive who perhaps wouldn't have chosen those options. And the point of the advanced decision and the advanced statement is that the advanced statement says how you want to be cared and what you want to happen to things like your pets and your home, but the advanced decision is explicitly, and it's a medico-legal document that says what you don't want and under what conditions. For example, do not resuscitate orders would fall under an advanced decision. Now, those are quite strictly controlled, and there are lots of rules around it because it is such a sensitive area and it is a legal document. But we worked with the charity in order to turn that into a plus and say, well, actually, the documents that we're producing here are legally valid. And what you need to do is go through the process of learning about it, thinking about it, creating your own document. And then once you've done that, you need to share it. It needs to be part of a conversation. It comes back to this idea of culture change, so that when you have created it, it is no good to download the PDF and leave it on your computer or to print it out and put it in your drawer. You need to share it with your loved ones. You need to share it with your GP. Use it to stimulate conversations so that when these events eventually do happen to you, it's not the first time that you're talking about it. Now, the outcome of all of that is people get the care, or in this case, don't get the care that they choose not to have because they're prioritizing their quality of life over their quantity of it. It has benefits across the system because keeping people alive in those last few years of their life is the most expensive thing that you can do. And it doesn't put people into a position where they have to make decisions on behalf of someone without knowing, because there's been a considered, well thought out process in getting there that can be validated. And I think that's a really good example of what we were talking about at the start about individualization and personalization of care. There still remain, to go back to the other part of your question, Daniel, these sort of barriers and sort of staggers of organizations being prepared to accept that risk. And that is because we still are very heavily focused on a blame culture. Patients to have access to this information because it's a risk for us, for our professional liability.
That sounds very old style thinking to me. Is that what you're saying?
Yeah, absolutely, but it's incredibly prevalent and it has not yet gone away.
So but Ben, that for some reason what Lorenzo was saying links me into you on what you're saying, legislation being carefully crafted. Sorry, Ben, you maybe have another point on here, but I was thinking about the legislation being actually opening up avenues as well. But please do comment on what Lorenzo said there, Ben.
Yeah, I mean, yeah, you're right. The Mental Capacity Act, for example, was designed to try and really help empower people. And what it does sometimes is it just lets different departments say, well, if we want to, we will help, and if we don't, we won't, which is a real shame, which is how the law gets used. But I was thinking about actually, we had a project with Maldaba where they were talking about the annual health checks for people, and people were able to upload things like photographs. And obviously the first question that came up from GPs is, what if someone's got like a skin condition or a broken leg or something that I should be picking up in these photographs as a thing? How does this increase my risk of being thought of? And that was the very first question that came through. Well, you know, what is the risk? What is the process that goes through? And it really happens that people will say, I'm worried about this risk. And actually what the this is when you look at the way it was used, it's really on a day-to-day basis, it's not going to be that. And 99% of the situations is people aren't going to be uploading photographs of injuries that they want the doctor to diagnose. So it's
having said that, there are some brilliant technology out there about people sharing their own photos in a secure way. But the best one I've actually seen of those is photos which I can actually analyze your you talked about before, which can analyze your living space, some of the new technology, analyze your living space by an app to show where the potential risks are in the room.
We've been there's a program that we've been working with a company where they do wound care. Wound care costs the NHS millions, and what it does is it allows you to take an image, and then it can start analysing and overlaying the wound to show you how it's going, and it can do a sort of like a bit of an image analysis of that wound, and I think that it was really useful then because then we could start introducing and upskilling some of the care workers, because then we move from a space where we have people who are only nurses can do this wound care monitoring, but actually we have a situation where we're trying to do a pilot now where we're saying, well, care workers really would like to start being able to have a career progression and look for different pathways in which they can work. And it does feel like at the moment there are lots of blockages. If I become a care worker, my opportunity to become a care manager is essentially as big as my team will be, and not very long, see how long it will be. So if we have opportunities where you can do things where you end up taking a photograph and doing something like that, but expanding your skills in this way and being part of the network of working with nurses, so that social care and the NHS start working together a bit more, then people start building that level of trust again. And I do think this comes down to, a lot of it comes down to trust. And
that trust, and that what I'm thinking there to bring you in there, Emma, is about bringing it back out, almost tying in what Ben was saying to the digital maturity of the system. That, and referring to what Ben said, that phrase almost you were hinting at, Ben, which is, I'm just a care worker. That just is something to get over. The skills that people are having to develop. One on being technology advisors almost, and my TV doesn't work, can you help me? Example is something that I know people are being asked as care workers. Emma, how's that, the people that you worked with, how are they changing? How are they becoming digitally mature as part of a digitally mature system?
Well, I think there's as younger people come into care, they are much more digital savvy anyway. So they have those skills that sort of part of your genetic makeup, isn't it? The sort of younger generations. So I think in that sense, that's going to help to change naturally, sort of evolve how technology is used within care. I think that in terms of Ben was mentioning trust, and actually we need to be able to trust people who are working on the front line, those sort of frontline care workers, to actually and empower them to really start to think more creatively.
Can I push you on that one, Emma? Who needs to trust them?
Management. I think management need to trust them, as well as potentially families as well need to trust those people who are actually, apart from the end user, the supported person themselves, they are experts in their field. They are the ones who are working with those individuals day in, day out. They have to have a range of skills that aren't required in many professions, from sort of empathy, really good communication skills, good digital skills now as well, which wasn't a requirement previously, which is where some of the tensions currently are in terms of how we can upskill people within the workforce. So a whole raft of skills that are required, and they're paid national living wage, which is, we need that career progression, so that they first of all, that they feel valued, and also that they can progress and feel like there's opportunities, because that will then start to help with all the challenges around rapid turnover of staff and retention of staff, which we're facing at the moment.
I also want, Ben or Lorenzo, please do come in here. Emma, that's brilliant. I think I even want to widen that out, that trust. One of the things I was pushing at is that trust in an integrated care system, care workers being trusted by their health colleagues, for example. And that for me is part of the digital maturity, when we're talking about systemic change I think that's coming. I'll go to Ben first because he's nodding more than you, Lorenzo, at this point. I'd love to see the faces of the people actually, of Steve and Ben and people on the chat, because I think there's a lot of facial recognition that I'd love to play off. But Ben, going to you first on that one.
Well, this is what I like about a lot of the digital projects, is that often whenever you do create a record, there's a whole load of metadata, there's a whole load of data about what's going on in the background. So you've created a record, you did it at this time, this is what's happened, sometimes this is the location where it's happened. And so the more you have that data and the more you can create that data, you can say, well, yes, our care worker was there, they were here at this time. And sometimes the care workers will be concerned that maybe this is used to track them or to monitor them, but actually being able to create an evidence base to say we know where our carers are, what they're doing, what tools they're using, when they're using it, and how they're using it, is a great deal of way to be able to build trust. We can show you what's going on. We have the records, and I think that often helps people and commissioners to say, okay. And people were using old tech ways of doing it. You know, you arrive at a service, you arrive at someone's home, you pick up a phone, you phone to say I've arrived, and you would have to dial into the commissioner's logbook that would record these things. This was not too long ago. This is like a couple of years ago that I was working with a service that did that. So the more you can get people to start working together, they can start seeing each other as real people, you know, and realize that actually, you know, this is not just a group that we're talking about, but actually this is a person that I know the face of, and I can work with them, and I have worked with them before.
Ben, it's really interesting. I want to bring Lorenzo in here as well, because one of the things we were wary of in preparing for this webinar was we don't want to just be in our echo chamber. You know, you, me, Lorenzo, Emma, and people on the chat. We know our own thoughts. We know the positivity of the potential here. How do we actually bring that wider and bring other people's views in? Just to challenge you on that, because I think that for me is part of how we become part of a mature system. Lorenzo, does that take it too far? Maybe overstretching? Because what I'm interested in here is one of the things we've said we'd deal with is how we make the developments sustainable. We don't just want them to come in and go out. This is to become business as usual in a way.
Well, one thing that came to my mind when Ben was just talking there about, you know, the modern way where a care worker can arrive, they've got an app, they can say they've arrived, or it can even geo-track them to say they've arrived, and that information can be shared and is really useful, and it ties in with your question about sustainability, Daniel, is that we've always said and we've always maintained that in order to make technology sticky, in order to make it hang around, it has to work for all of the stakeholders. So, you know, we may get approached, for example, by senior managers, this has happened in the past, because they want bean counters. They want to know how they're
senior managers of care organisations.
Yeah, for example, yeah. Sometimes even commissioners within local authorities, they want to be able to count. They want to know that things are happening, that what's being paid for is being delivered, that the quality is good, and they want to be able to have the numbers and the figures either for reports or for new funding bids, tenders, that type of activity. There's no incentive in their request for the people on the front line to do it. So why would the care worker press that button just because their manager wants to know they arrived? Well, maybe they'll press that button because actually that ties in with their payments. Because unfortunately at the moment people are still paid for when they arrive. So you say, okay, we'll press that button because then we'll know you've arrived, and that will tie in with your payments, and also the information that you put in there, that will go into the care recording system, so it saves on your paperwork down the road. So there's an incentive for the frontline worker to do it. The people who may access to that information, which is actually not as unreasonable as it might sound, you know, such as the individual that's being cared for, or the families of that person, because there may be trust issues that the family don't believe that the supported person is getting the right sort of care that they need. That information can be shared quite easily. We've done that working with HFT with Hear Me Now, where it did actually change that trust relationship, where one family went from feeling like their family member was getting no support whatsoever to realizing just how much was being done, but the family member wasn't telling them about it, because in Hear Me Now you had boxes where you could put the information, those could be securely shared with the family, and then they could see day by day all of the activities that were being done. So you have to incentivize all stakeholders in order for it to be sticky. And even then you've still got a challenge because you've got all the other things around funding that we haven't even come on to talk about.
So it's just brilliant because that you use was sticky. I don't know. I somehow prefer sustainable business as usual. I don't know, but we're all talking about the same thing. But what's really interesting, and I know this with care workers, and if Emma and Ben have had this as well, where people have been piloting things, and the care workers say, and the person who's receiving care says, please don't take this away. The pilot, this is the nodding that goes to Emma. Just come on that.
I think that's really, really important point, because that happens so often where when you do a pilot, the sustainability is not actually considered, and that is a fundamental
Do you mean the funding model in sustainability or other issues?
Well, funding is one of the key things really for affordability, to enable that person to carry on using it, because to actually give somebody something that helps them to communicate and start to manage choice and control, and then to take it away from them is worse than giving it to them in the first place, in my view. So actually building in that sustainability in terms of funding, but also in terms of embedding it into processes and procedures, like your support plan or checks or whatever that might be, are fundamental, and often are not regarded as part of a project or a pilot, or actually an implementation modelling, really. It's often, put the technology in and you monitor it, but actually how are you going to sustain it long term? So yeah, I think that's critical, really, because taking something away is criminal, in my view, if it's something that's working for somebody.
I'm looking at John Sell's notes in the chat, and I'm going to admit my own ignorance here. John says we've been doing some work for the LGA on information and advice, the Local Government Association on information and advice. An ongoing question for anyone he's talking to is about what works in terms of I&A. What is I&A? Sorry, I'm going to show my own ignorance here. John, can you
say information and advice?
Information and advice. Okay, right. Okay, yes. Sorry. Thank you for pointing that out. I'm just trying to look at it. Yeah. So, what works in terms of information and advice, and what doesn't work? The real sticking points are in trying to access that information and advice. So does this open up a whole new vista of people finding their own information and advice now? People taking over the care from care professionals, maybe. There's this democratization. I think one of us mentioned democratization as well as personalization. Is that part of digital maturity, Ben?
I think it's what people want. I think it's interesting. Often, what concerns a number of commissioners is how do we ensure privacy? And when we speak to people don't necessarily view privacy in the same way. A lot of people, when we engage and consult them, say, "Well, why is my information not already available to my GP and my care worker? Why are they two separate organizations?" And you have to explain how the structures work. But there's a kind of expectation that if I'm receiving a service from you as a care worker, then you should be able to contact my GP, and that shouldn't be a thing that's necessarily a barrier. Sadly, it often is. So I think that when we start speaking to organizations, people kind of go, I want my data, I want to be able to know what's being said about me. And I think the NHS app is making some really good progress in that, in certain degrees, about being able to do that as a good example. Slowly it's happening, but it is happening. And I think that it's going to be an expectation and a business as usual, just as you would see this in any other business, where you can see the data that you put in about it, that you can do the same with your health records.
So I think, I want to try and deal with a lot of the stuff that's coming in the chat. So we're coming to almost the end, so it's a good point for each of you to be able to summarize what you want. I also want to think in the summarization, if that's a word, where you want to actually look at something you were driving at there, Ben, is this is a way to actually deal with the inequalities in the healthcare system, its accessibility as well. So people can address, I'll turn to you, Lorenzo, first I'll come to Emma first to summarize your feelings about how this webinar's gone and what you've taken from it, actually, and maybe things that you've learned in this chat, and what people should be taking away. And we will try and deal with all the points in the chat in retrospect as well. So
I think
I think
we could carry on talking probably for another hour. So from that point of view, I think it's been really good. I think having us from different, backgrounds and areas has been really useful. I think for me, the key things really that I've taken away around the need for culture change, definitely, and how that happens. And I think everyone potentially on this call, we all have a part to play in that, and we all have a responsibility to play in that. It's not just on one group or one stakeholder. So actually my takeaway will be how I can make a difference to start chipping away at changing the culture in my role. So for me, I think that's something that I've thought of as we've been going through. I think the other thing I just wanted to touch on, which was
quickly, Emma, because we've got another 5 minutes.
Oh yeah, that's fine. Yeah, crack on. Move on.
No, one more point, please do finish that point.
I was just going to say, actually, the sort of product developers like Maldaba are very unique in terms of understanding the culture and the behavior change that happen, and that's something that's not often part of a product developer or a supplier's mindset or culture.
That's a great way to finish, Emma. And Ben, over to you on your takeaway points and things you want people to work on more as well.
I think if you want to be seen to be digitally mature, you need to be legally literate with what's going on. You need to put the person at the center of your product, and then you need to focus and spend more time on working out how to create a culture change in the organization and finding champions than you do necessarily on developing your product. It's quite an uphill struggle, and if you don't.
But we have the tools now to involve more people, I think, Ben. That's a good point. And Lorenzo, coming to you as a sponsor of this webinar and taking the discussion on digital maturity and how we progress, the final word to you on how your takeaways and where we need to work.
Yeah, I was just reflecting on that and listening to both Emma and Ben in their summaries. And even though we put culture change at the front and also at the center of everything that we do, it never ceases to amaze me how I constantly need to be reminded of that, and we all need to be thinking of, it's not about the new shiny toy. It's, if you want to make this change and you had a blank sheet of paper, how would you design the organization to actually embody that change? Now, obviously you can't do that in real life, but you have to, if you're going to make culture change, you have to know where you want to get to. And sometimes the problem isn't just the willingness to make the change, it's having the vision of what that needs to look like. And then you need the tools to do so. And obviously that's kind of the areas that we dominate, but it always comes back to this same thing of what are the changes that you want to end up being, and then creating a pathway to get there and use the technology to help you do so.
I think that's a great way. That's a great way to finish. Well, we're not finishing because this is an ongoing discussion, and I think we'll try and deal with all the points in the chat in retrospect. I can't deal with them all. One of them we haven't really dealt with is I think I forgot who made it. Sorry. Someone Steve's saying, could the panel make the difference between healthcare and social care? And that's something we can come on to. But in my mind, they're morphing together a little bit potentially with the digital transformation. But we have to leave that for another time because we're coming close to the end. So thank you everyone for joining today. It's been really fascinating. We're going to build on this series, so do join us for the next one is. I'm not sure when the next one is, but we will get the word out to you, and we'll do some summary of this of today's. So I think it's for me to say thank you to you all. Really interesting. I've learned so much today, which I'm going to take away. But please do keep the conversation going. This isn't the end of a conversation. This is the start of a conversation. So thank you very much, and we'll hope to see you soon. Thank you, Ben. Thank you, Emma, and thank you, Lorenzo, for sponsoring this valuable webinar.
Thank you, Daniel.
Yeah, thank you for hosting.
Thank you, Daniel.
Okay.
And thank you,
Bye, everybody. Thank you very much.
Bye-bye.
Bye-bye.